I am Dr. Gretchen, a psychiatrist and therapist, associate professor of psychiatry, and I'm here to talk about more basic information about depression. If you missed the first video, make sure that you watch part 1, where we talked about signs and symptoms of depression. In this short video, we'll talk about more general information, theories, and treatment approach to depression. Like anxiety, depression is one of the most common psychiatric conditions. Depression can happen at any age. Untreated depression can last between 6 to 12 months. Some will resolve on its own, while others will have lingering symptoms. Depression can happen in a single episode or repeat. Unfortunately, after a second episode, the risk of recurrence increases to 80%. This makes treatment really important. Remember, all the signs, symptoms, and experience must be put in the right context, and that all available information must be considered in diagnosing and treating depression. Stressful life events sometimes trigger depressive episodes. These are disruption to social situations or life change like relationship conflicts, divorce or breakup, moving, change in job situation like being fired or just moving on to a new job. Even news of illness or death of a loved one can trigger depressive episodes. Thinking about depression in an oversimplified way, where we are searching or focusing on just one cause or one solution, limits healing. For example, some people focus on just the chemical imbalance theory in depression. This idea is influenced by the response people have from antidepressants that enhance the activity of neurochemicals like serotonin, adrenaline, and dopamine. As we've learned so far, just focusing on these chemical dysregulation is oversimplified, and that the depression picture is much more complex given the influence of other factors like genetics and environment. I have never worked with a patient where medication is the only answer. There are in fact many who may not need medications. If meds are used, they are often helpful in toning down the body's reactions so you can think clearly, make different decisions, or behave in a healthier way to improve your experience. In really understanding depression, it's more helpful to explore problems in processing information where there's a tendency to focus on negative triggers like thoughts or feelings. This negative affective bias or negative emotional processing refers to your tendency to give more weight to negative experiences or information compared to positive or neutral ones. This means that when you have negative affective bias, you're more likely to focus on, remember, and be influenced by negative events, emotions, or thoughts. This can accumulate and become a vicious cycle and reinforce negative thought patterns. This emphasizes the importance of treatment like therapy or self-help exercises that teaches you to challenge and evaluate your thoughts. In his book, Memorable Psychiatry, Dr. Heldt notes that the tendency for negative emotional processing can cause one to consistently underestimate their chance of success. This leads to feelings of hopelessness, isolation, and lack of desire to engage in pleasurable or rewarding activities. This really shows how depression often leads someone to think, I'm not good enough. Other people will laugh at me. I'm not deserving, or I'm all alone. Treatment focused at improving the negative affective bias can be helpful, like psychotherapy with or without medications. For example, some people who are treated with antidepressants are more able to focus on positive stimuli and become less reactive to negative facial expressions. This provides space for applying coping skills learned from psychotherapy or from an uplifting conversation with a dear friend to help with unlearning depressive thought patterns and behaviors. This creates new patterns on engaging with the world in a way that are healthier and more helpful. If you or someone you love are experiencing depression, remember that treatment is possible. I encourage you to choose to give healing, hope, and feeling better a chance.